Camden has a higher poverty rate compared to surrounding counties.
More people in Camden are on Medicare than most places in New Jersey.
There are fewer primary care providers in Camden compared to most of New Jersey. Camden has a higher mortality rate due to heart disease.
To us, South Jersey is full of opportunity.
And we take that very seriously.
I was hired for a program back in 2014 that was part of the Medicaid expansion program, and we had to demonstrate that we were putting together a program that would deliver care in a different way.
I've known Dr. Randle for about 10 years. I've always been impressed by his leadership skills, his commitment to his community, and when I decided to launch this program, I knew I needed his help.
I think that we both understood each other's passion to serving the community, educating the community. And Dr. Momplaisir approached me and said, I think I have a way to make this work.
Access to care is one of the major factors that impact healthcare disparity.
In terms of planning, our first level of planning was launching health fairs, which I think were very successful.
I have to say, when we first started doing the community health fairs, I was always a little skeptical because it's very challenging to get patients to show up at health fair.
It was a very nice event. You had a family table where kids can color and write while their family members were going around getting tested.
I wouldn't say it was like the average run-of-the-mill health fair where you just come in and here's a flyer and here I'll prick your finger for a health screening. I thought it was really nice.
We also take blood pressures and monitor cholesterols at the events and provide on-the-spot education.
People were really into it. I mean, like when he was done, people were up talking to him, and asking questions.
And I think that's a wonderful thing because the city is underserved sometimes, and for him to reach out to the underserved, like I said, that's his loving personality, love for people.
We had over 300 patients, and it was one of the largest health fairs that the hospital has done.
I think that we're trying to find avenues where we can reach out and touch the community, educate the community, without them necessarily seeing us for the first time in a hospital setting. The next phase was then reaching out to the community.
Troy, when he first came in, he was like just a regular, I thought he was just a regular guy. And after engaging in conversation, I later found out he was a doctor. And I was a little surprised.
So Troy actually was a patron of the barbershop for a while, and he began to start to talk about medicine to the barbers and different people who came into the barbershop, and then he became known as Doc. So from that point on, Troy made it a mission to bring teaching into the barbershop, encourage people to eat healthy, encourage people to check their blood pressure.
We look at things that we can change, so what can I change? I can change lifestyle. So smoke is a big risk factor.
But I always say the best investment is the time you put on yourself. Spend time at the gym, exercise, take care of yourself.
So people come here, they can expect other than a haircut. I mean, you get some good medical advice, and it really adds to the shop.
I would say keep an eye on your blood pressure. Again,
it was frustrating for me to see the same type of patient coming back with repeat heart attacks and try to understand why these patients were not compliant or not taking their medications.
There's a lot of things that people deal with that often they get the label non-compliant, but they're not. They're really trying very hard, and they make tough decisions every day.
You have to understand your disease process. We want to prevent things from happening because although he's my boy, you don't want to see him.
You don't want to see me at 2 a.m. I mean, it's true. I mean, we play off each other like that because I think it's important for a patient to understand that preventive medicine is crucial. And the only way you could really make an impact, you have to get to the patient's level. I do a talk on signs and symptoms of heart disease. To the whole process, I go over exactly what to expect if you're having a heart attack, what you need to do. And he talks about the risk factors, like the high blood pressure, the diabetes. And you'd be surprised how patients did not understand how having high blood pressure is a major risk factor. When we're talking about healthy eating in Camden, and you don't have fresh produce, access to fresh produce. And we've been working also to establish that.
Lourdes actually has, across the street, is a farmer's market for different families to come at the Osborne Clinic.
This award illustrates the hospital's commitment to the South Jersey community. Our Access to Care team working collaboratively with the hospital to address some of the healthcare need of the community.
Lourdes is all about the community. It cares about the patients. It cares about employees as a whole as well. So overall, it just really is a niche for the Lourdes mission statement.
I think the award stands for Lourdes' commitment to community service.
I think it really validates all of the hard work that they put in, all the long hours and their persistence in launching this program.
I'm proud that he gives back to the inner city. I'm proud that he engages the children in his activities in the community. I'm proud of his leadership.
I couldn't feel that they're more deserving of it. They're doing it on their time. They're putting their effort into it. They're helping the community. They're helping the hospital. How can you not be proud of that?
They're just so committed, and I don't know how they maintain that every day, but they're driven. They are really driven.
Our vision is bigger than even where we are now. I don't see this stopping.